So we are going to the next talk on traditional and complementary medicine in Turkey. It will be presented by medical doctor Mehmet Zafer KALAYCI from Ministry of Health, Traditional, Complementary and Functional Medicine Department of Turkey. Please, you have the floor.
Ekran paylaşıldı mı acaba?
Can you see my screen?
Yes, we can see.
Okay. Teşekkür ederim.
Okay, thank you. Firstly, I would like to start by giving my thanks to FAO and Professor Mustafa Ceylan. This event is running very smoothly, and I would like to extend my best regards to all other participants. Before I start, I come from the Ministry of Health. I am the head of the Traditional, Complementary and Functional Medicine Department, and our department got operational in 2010. In 2012, in fact, we got engaged in more active operations. This is our mission: to make the legislation work related to traditional and complementary medicine practices in the country. Licensing, inspection, control, training, and certification of this field, and to ensure the regulation of clinical research. To develop the field of traditional and complementary medicine practice in country by national and international collaborations. We'd like to improve the life quality of the society, and that is why one of our aims is to provide the integration of traditional and complementary medicine practices to health services. In addition to contributing to the health economy, health investments, and health tourism in our country, also our aim is to contribute to promotion, development, and generalization of evidence-based traditional and complementary medicine practices by executing studies with the EU and the WHO in our country. All these make up our vision. My department consists of 4 units. So one unit is dealing with the licensing process. One unit is dealing with the training process. Auditing and assessment is under the mandate of the 3rd unit, and also the 4th unit is dealing with the legislation and international relations. In fact, in 2012, we got engaged in active operation. In 2014, our regulation on traditional and complementary medicine was issued. There are 15 headings of the regulation: acupuncture, hypnosis, hydrotherapy, reflexology, ozone therapy, chemotherapy, phytotherapy, mesotherapy, osteotherapy, chiropractic, magotherapy, apitherapy, prolotherapy, cupping therapy, and music therapy. For all these 15 headings, we established the training standards, and very recently, in 2019, the regulation on clinical research on traditional and complementary medicine practices was published. And in fact, we partnered with the WHO for this. Our aim with this regulation, in fact, is to regulate procedures and principles with regard to doing scientific research on human beings in the field of traditional and complementary medicine practices, and protecting the rights of volunteers within the framework of international agreements that one is party to, and good clinical practices. As I said, all these happen within the framework of our partnership with WHO. This is our website. It is published in both Turkish and English language, and the address is shown here, and the English version is tcmanatoliasağlık.gov.tr. On the English page, you can find all our legislation, training standards, educational standards, and also the clinical research regulation. They are all available in English language there on the website, and we try to keep it up to date as much as possible, and also international researchers support us a lot in keeping up to date. Let me talk about our practice centers. Practice centers are equal under universities. Are in fact R&D part refers to the practice centers. In total, we have 78 of them in Turkey. Units are dealing with the implementation. So they are the outpatient clinics or other healthcare institutions. Currently, there are 1,319 units in Turkey. These are units that we license and we inspect. So the physicians and dentists work there. And the dentists can only intervene in the oral cavity and the teeth. I would like to make efficient use of time, so I am skipping certain parts. And as I said, the clinical trials regulation was published in 2019, and I think it is unique in its kind, and WHO supported us a lot in this framework. Also, on the 15th of May 2019, we published the Good Clinical Practices Guideline. On the same website I introduced you, you can find its English version. It's available for those who are interested, and it is also available in its Turkish version on the Turkish webpage. So in the framework of the clinical trial regulation, we organized 5 training programs concerning the good clinical practices, and also we certified many people. Turkey is geographically very rich. So our origin is from the Central Asia, and also we started many civilizations in Anatolia, and also we are lucky with the Silk Road, all contribute to some enriched traditional and complementary medicine, and we try to benefit from it as much as possible. Currently, 5,250 medical doctors and dentists have been certified in terms of traditional and complementary medicine, and when you include the other branches, the total number of certificates is over 18,000. So Hirudo is under biotherapy. Biotherapy also includes apitherapy, magotherapy, and hydrotherapy, 3 practices you see. And for apitherapy, there are 176 practitioners, and there are 8 universities dealing with this, and there are 18 doing this practice. For magotherapy, there are 115 practitioners, 8 universities are providing training and R&D. Hydrotherapy is a leech therapy, and let me talk on it. Currently, 1,480 practitioners are there. In 25 universities, there are R&D activities. In particular, 13 universities also provide training. 26 units, including private and public, also provide practice. We use medicinal leech in leech therapy, and the species used are Hirudo medicinalis and Hirudo verbana. And also, according to legislation, they have to procure it from the medicinal leech suppliers. And also, the eradication procedure of leeches, in fact, it shall be applied in accordance with the medical waste control regulation, which was published in the official gazette in 2005. Leech therapy is a supportive therapy according to our regulation. This is how it is defined, and it cannot treat a disease single-handedly, and that cannot be asserted. It is clearly specified. And in degenerative joint diseases, in osteoarthritis, it can be used. It can be used to relieve pain in varicose veins of lower extremity and to relieve pain in the diseases such as lateral epicondylitis, and also in venous insufficiency after flap surgery and after replantation and revascularization. It can be used. Currently, we are revising the legislation. Indications will be increased. We are checking the developments in the world, and also we are hearing the recommendations of the professors. And also after this two-day webinar, we are planning to expand the indications. And also there is the impracticable part that is defined in our regulation. But I'm not going to read this paragraph for time management concerns. In fact, as much as possible, we would like to have some joint studies with the universities and other institutions. And you just heard some details from the Ministry of Agriculture. We partner with the Ministry of Agriculture, particularly in the production, storage, and sales of medicinal leech. We act together with the Ministry of Trade and Ministry of Agriculture. And also in the universities, there's support coming from the R&D departments. We work actively with the World Biotherapy Association and Professor Dr. Costa Mumcuoğlu from Israel is our partner in many studies that we have. In 2017, Turkey hosted the International Conference on Biotherapy. It was held in Istanbul. So one session was related to leech therapy, and it was discussed in detail. I tried to complete my presentation in the shortest way possible. I'd like to thank you for patience. You see our webpage once again, tcamanatolia.sağlık.gov.tr. You can visit our website at this address, and you can find the details in English on this webpage. Thank you. Yes, Victor, over to you.
Okay, thank you too. So we have 2 minutes for questions and answers. If you have any questions to address to the speaker, please raise your hand. If there are no questions, we will proceed to the last.
Well, Victor,
yes.
In fact, in the chat box, I see a question that is typed in Turkish. If it is okay for you, I can ask the question to the speaker.
Okay. Please do it because I...
Başkanım, ben bir şey sormak istiyorum diye başlanmış.
Well, here you can read the question, distinguished speaker. Is there any practitioner who is not a physician? Is there any record of it? Do you have any directives about this? So do you receive any cases reported to you about this? So they are asking about the qualified practitioners. What can you say about this? Well, thank you. According to the legislation in Turkey, the examination, diagnosis, and prescription mandate can only be given to the physicians and dentists. And that's all. And also WHO, in fact, really is proud of our operations, and our legislation is in full compliance with this requirement, and that sets a model for many other parties who are working actively with WHO to make sure of it. In the United States, in Europe, there are many problems about non-medical practitioners. In fact, only medical physicians and also medical dentists can be practitioners. We will make the necessary clarifications again in the legislation. No others are allowed to practice, and inspections and audits are made by the provincial and district health directors, and our department is involved. in this process as well. And in fact, the controls and inspections will be increased further, and non-medical practitioners will not be allowed. But I remember some case that was covered by media. I think there was somebody who is not qualified, but who was not qualified, but who was practicing, and there was some, police raid, if I'm not wrong.
Okay, thank you.